Welcome to your trusted health channel. In this video, I'll guide you through safe and effective dosing of cough and cold syrups for children. Whether you're a parent or a healthcare professional, this guide is made to ensure your child receives the right care. Important note: over-the-counter cough and cold syrups are not recommended for children under 2 years of age. For children between 2 and 6 years, use only pediatric formulations as advised by a doctor. Common ingredients in pediatric cough and cold syrups include antihistamines like chlorpheniramine or cetirizine, decongestants like phenylephrine or pseudoephedrine, cough suppressants like dextromethorphan, expectorants like guaifenesin, and paracetamol for fever or pain. Let's break down a few examples. Chlorpheniramine ml. Dose is 0.35 milligrams per kilogram per day, divided into 2 to 3 doses. For a 15 kg child, that's about 5.25 mg per day. If syrup has 2 mg per 5 ml, then give 3.5 ml twice daily. Phenylephrine. Dose is 0.25 mg per kilogram per dose every 4 to 6 hours. Maximum 1.5 mg per kilogram per day. For a 15 kg child, that's 3.75 mg per dose. If syrup has 5 mg and 5 ml, give 3.75 ml per dose. Dextromethorphan. Usual dose is 0.5 to 1 mg per kilogram per day, divided in 3 to 4 doses. Maximum 60 mg per day. For a 15 kg child, total per day is 7.5 to 15 mg. If syrup contains 5 mg per 5 ml, then give 2.5 to 5 ml 3 times a day. Guaifenesin helps thin mucus. Dose 6 to 12 mg per kilogram per day, divided 3 to 4 times. For a 15 kg child, it's 90 to 180 mg per day. If syrup contains 100 mg per 5 ml, give 2.5 ml 3 times daily. Here are 5 safety tips for parents. 1. Always check your child's weight and age. 2. Use measuring syringes, not spoons. 3. Never use adult syrups in children. 4. Avoid multiple syrups with the same ingredients. 5. Consult a pediatrician for infants and toddlers. Thanks for watching. If this video helped you, please like, share, and subscribe for more trusted pediatric content. Comment below if you'd like a printable dosing chart or calculator.